Hi everyone, Tim Wood, broker owner with theplanadvisor.com. I get a lot of questions when people are just getting ready to get into Medicare about what does all this mean, all these A, B, C, Ds, and all these different things. So we put together this quick video with some explanations of exactly how everything works. So hopefully this is going to clear things up and make it very easy for you to understand how everything works. So once again, my name is Tim Wood. And what we're going to do today is we are going to cover exactly what Medicare is, who's eligible, when they can get it, and how all its different parts work. What your options are, a general idea of costs, some important dates, and so on. So here we go. First, what is Medicare? Well, it's our government's largest health insurance program, serving over 60 million in 2019. It's run by the Centers for Medicare and Medicaid Services, which is called CMS, and President Johnson signed it into law in 1965. Medicare basically has 5 parts. A and B are original, C is Medicare Advantage, D is a prescription drug plan, and then supplements help cover the gaps in original Medicare and are sometimes called Medigap policies. We're going to go over all these parts today here in detail. So generally, Medicare Parts A and B are available for people age 65 or older. In some situations, even while you're still working. That's on a case-by-case basis. You may also be eligible if you're a younger person with disabilities or if you're someone with end-stage renal disease. You can enroll in Medicare for up to 3 months leading up to your 65th birthday, during the month of your 65th birthday, or the 3 months immediately after the 65th birthday. So you've got a 7-month window. Now, it's really important because if you haven't enrolled by that 3rd month, at the end of that 7-month period, the 3rd month after your 65th birthday, then you're subject to ever increasing late penalties, and some of those never go away, ever, for the rest of your life. So you need to make sure you get started as soon as possible so you can avoid paying a penalty for the rest of your life. You don't want to do that. So let's get into the parts of Medicare. Original Medicare covers most of your care from doctors and hospitals, and it has a deductible and co-insurance like traditional insurance. Part A is your hospital coverage. It also covers skilled nursing, hospice, and home health care. If you've worked at least 10 years in a full-time job in the United States during your lifetime, this coverage is provided at 0 premium, completely free to you. There is a $1,408 deductible and co-insurance, which is the part you pay, with every hospital stay. Basically, anything to do with a hospital stay is covered under Part A. Now, Part B is your doctor's appointments, outpatient, preventative services, physical therapy, and there's more things that it covers. Most people for Part B pay $144.60 every month for this coverage. And it has a $198 per year deductible, and then there's 20% of the Medicare approved amount as co-insurance, and that's, once again, that's the part you pay. Now, there are no out-of-pocket maximums for either of these, parts A or B, and neither include prescription drug coverage. Now, this is a big deal because with no maximums and no drug coverage, you could have a massive bill if something major happens. There was no need for prescription drug coverage when this program became law in 1965, so it wasn't included in original Medicare. That's where Part C and D come in. These are offered by private insurance companies, not the federal government. Part C is the same as Medicare Advantage, which covers everything Parts A and B covered, so your hospital and doctors, and typically includes much lower deductibles and co-insurance. It's also got out-of-pocket maximums, and a lot of times it has other services like prescription drugs, dental, vision, gym memberships. There's all kinds of goodies that can come with these. Part D plans are just standalone prescription drug plans, and we're going to get into more details on both of these here in just a minute. Now, here are your options. Almost everybody gets Medicare one of 3 ways. The first is just original Medicare. That's option 1 up there on your screen. Parts A and B, hospitals and doctors, this is through the federal government. The challenge with this option is there are no out-of-pocket maximums. There are deductibles and co-insurance and no drug coverage, but some choose to stay with just A and B. The second option is adding a Medicare supplement plan along with a prescription drug plan. Now, this basically covers the gaps in original Medicare and provides drug coverage. These plans are somewhat pricey, but can be great in certain circumstances. The third option is a Medicare Advantage plan, which includes Parts A and B, and typically include many benefits and services original Medicare doesn't, with much lower deductibles and out-of-pocket maximums. Most also include drug coverage. Now, these are available through private insurance companies. The option 2 and option 3 are both available through private insurance companies. And between these three options, over 99% of people will choose one of these three, and it'll work great for them. So chances are pretty good one of these three is going to be the direction that you go. Now, as far as the important dates go, there's two main election periods every year. The first is the annual election period, or AEP. You're going to get to know that very well. That runs from October 15th through December 7th. Now, during this time of year, you can select your Medicare Advantage and your prescription drug plans for the following year. This is generally the only time you can make this change, unless your situation falls under a special enrollment period, or SEP. And there are multiple types of SEPs, like moving or leaving an employer plan, losing your current coverage, your current plan changes. There's several different things that can happen to put you into an SEP. Also, if you have Medicaid coverage through your state, you can change plans whenever you want. Now, when you're making your choice for Medicare, there are basically some main factors that you need to consider. The first is cost. How much will you pay for the premiums, the deductibles, the co-insurance, and co-payments? You have to make sure it's going to work with your budget. Next is what benefits are provided with each option. Does the option you're looking at include prescription drug coverage? Does it have an out-of-pocket maximum? These things make a huge difference. Then there's convenience, making sure the plan's in-network providers are close to you. Then what you think your needs will be. Have you needed care in the past few years, and do you think that's going to increase? And lastly, are your doctors and preferred hospitals, are they accepted by the plan? You got to make sure of that, obviously, if you want to be able to use them. And then once you weigh all these factors, typically one option stands out as the right choice immediately. But you have to watch out. Because there can be a massive difference in yearly out-of-pocket costs between options. The three biggest deciding factors in which way you will work best for you are: what's your history? Like, do you have a chronic condition, or do you take expensive medications? And will your needs grow in the future? What prescription drugs you take, which is what you spend now and what you could spend in the future. And then lastly, do you need more coverage than Parts A and B can provide, and lower deductibles and a yearly out-of-pocket maximum? So now let's look at Part C, which is Medicare Advantage. More closely, in order for you to enroll in Medicare Advantage, you must already have Parts A and B. Again, you must go ahead and get enrolled in Parts A and B when you become eligible. Then you can look at adding a Medicare Advantage plan. These plans sometimes have an additional premium, but in many cases, they're available at zero premium as well. So you're getting all these additional benefits, zero cost to you in a lot of cases, not all. You must keep paying your Part B premium and remain a Medicare member. You may also have the opportunity to select additional benefits like dental, vision, or prescription drugs. Now, there's basically four types of Medicare Advantage plans. First is a health maintenance organization, or as we know it these days, an HMO plan. You may be familiar with it already. Basically, you'd have a primary care doctor that would refer you to others in the network when you needed it. With an HMO plan, you must stay in the network for your healthcare costs to be covered. Next is a preferred provider organization, or PPO plan. It lets you choose any provider that accepts Medicare, but you typically pay less if you stay in network. A private fee-for-service, or PFFS plan, may give you more freedom, but all doctors don't have to accept it, and the insurance company, not Medicare, determines how much you will pay for the services. And then lastly, special needs plans, or SNPs, are special plans for those with chronic conditions or are in long-term care or skilled nursing facilities. Each type of plan has its advantages and disadvantages. You need to look at all your options and make the best decision for your situation. Now let's talk just a little bit more about the special needs plans, or the SNP plans as they're called. These are typically more focused on specialized health care to deal with whatever the special need is. To join SNP, you must have both Parts A and B and either a chronic illness. We're talking about something like diabetes or a heart condition or something like that. And receive Medicare assistance from the state, or residing in a nursing home, or you need nursing home care. Now, SNPs include all parts of A and B and D benefits. The great thing about SNPs is they're designed specifically around specific special needs. For example, if you were diabetic, there are SNP plans that are focused on diabetes management, diabetic testing supplies, insulin, blood test, everything that you would need included in that plan specifically for that. So they work really well if you can get approved for one. They're more like having a policy designed with your specific needs in mind. Now, the extra benefits that come with Medicare Advantage make it very attractive to many people. These include gym memberships, prescription drug plans, vision, dental plans, mail order pharmacy, a nurse hotline, or virtual doctor visits, and out-of-pocket maximums. That's big. Out-of-pocket maximums are a big deal here because there are no limits at all in original Medicare to the amount of money that can come out of your pocket. Each plan is different, so you must see what's available for you and determine what's going to work best in your situation. Now, let's briefly cover Medicare supplement plans. These plans are also called Medigap plans because they cover the gaps in original Medicare, and they work with original Medicare Parts A and B. They're designed to pay some of the costs Parts A and B don't, like co-pays, co-insurance, and deductibles. Each Medicare supplement plan is unique, but typically has a much higher price tag than a Medicare Advantage plan. However, there are some people that want this type of plan because costs can be more predictable and they can see any provider they want anytime. They don't have to worry about going through a primary care physician to get referred for anything. You can go wherever you want at any time. Now let's cover Part D, prescription drug plans. Part D plans are available from private companies that contract with the federal government and are required to offer the basic benefits that Medicare requires. After that, each plan has its own list of covered drugs, which they call a formulary. So you need to make sure you choose one that includes the medicines you take regularly. There are two ways to choose a Part D plan. First, you can buy a standalone prescription drug plan to help cover medicine costs. Or you can get a Medicare Advantage plan that includes Part D coverage, and that's called an MAPD, or Medicare Advantage Prescription Drug and MAPD plan. Once you're in an MAPD, then you don't need additional drug coverage as it's already included in your Medicare Advantage plan. Now here's the challenge with just Part D itself, and that's the dreaded gap, coverage gap, or donut hole is actually what they call it, where you're likely to pay a higher percentage of drug costs. And basically what happens is you move in and out of this gap when your total cost reach a specified dollar amount, and that amount changes annually. For 2020, there's an initial $435 deductible that you pay 100% of. And then after that, you pay 25% of the drug cost up to $4,020. Now, after you've passed that $4,020 mark, you enter the donut hole. Now, here's the big difference. After $4,020 and up to $6,350, you pay 25% of the drug price. Big difference. Big difference there is between the drug cost and the drug price. So obviously it kicks up a whole lot. And then after you surpass $6,350 annually, then you pay approximately 5% of the drug price moving forward, and that's when you've entered what's called catastrophic coverage at that point. Now, these are dollars you definitely need to think about when choosing the right prescription drug coverage, because they can add up real fast. Now, there's multiple resources available. I would suggest everyone go to medicare.gov. This includes the Medicare and You Handbook and the Choosing a Medicare Policy Guide. At shiptalk.org, you can get information about your state health insurance program. Again, you can contact your state Medicare office and the Social Security Administration to see if you qualify for extra help to pay for your prescription drug premiums and costs. Now, here's a few last words to help you with your choices. Part D plans, Medicare Advantage plans, and Medicare Supplement plans all have separate premiums from original Medicare. That means Part A is still covered, but Part B, you're still going to need to pay that $144.60 a month premium in addition to whatever else you choose. As I mentioned, some Medicare Advantage plans have a $0 premium, but all standalone Part D plans and all Medicare Supplement plans do have an additional premium. So if you're looking for more coverage than original Medicare and something to help with those deductibles, co-insurance, and the fact that they don't have out-of-pocket maximums, you can choose a Medicare Advantage or a Medicare Supplement plan. Just select the coverage you want for the price that works for you. Your costs depend on the coverage you choose. Medicare Advantage costs depend on whether the plan charges a monthly premium, whether it pays any of your monthly Part B premium, because some do that, and what the co-pays, co-insurance, and deductibles are. Both original Medicare and Medicare Advantage plans cover some preventative services, and Medicare Advantage plans are required to cover absolutely everything that original Medicare does without exception. So you'll never get less coverage with a Medicare Advantage plan. So thanks for your time and attention today. Hopefully this helped clear up how Medicare works and how you can move forward. My suggestion is to find a professional that can help you make sure you make the right decision, and you will never pay more to go through a certified agent. Their service is completely free to all Medicare subscribers, as they are paid by the insurance companies. I would also recommend going with an agent that is certified with all the available Medicare Advantage plans in your area, because that way you have the best choice and you can make sure that you get the best for your specific situation. So once again, thanks. My name is Tim. I am the broker owner at the Plan Advisor. We are here to help you. If you need anything at all, just let us know, and we'll be here for you. If you need any more information, you can contact us at theplanadvisor.com. Thank you very much, and let us know if we can help you. Take care.